gentleman here.
Yes, so first of all, good evening. I'm Sami Higab. I did make an attempt several times to go to Gaza this year, but unfortunately I was denied entry even into Sinai Peninsula. However, I've been gallivanting around Egypt and visiting some of the displaced families and injured, even including injured children, in hospitals. I heard from eyewitness accounts, which is far more horrific than what we've actually heard today. Of course, I'm not an eyewitness, so I'm just from hearsay. I am very well aware of some of the people that evacuated into Italy. And my question, actually, I have two questions, one for the ambassador, but I'll ask you, gentlemen, at the end, regarding what can be done to evacuate. I mean, I know you've spoken about it, but what can actually practically be done to evacuate some of the patients that are currently inside the Gaza Strip, as well as some of the injured victims that are not getting treatment in Egypt, to get evacuated into the UK or elsewhere. And I have now contacts with the Ministry of Health in Egypt. I'm very regular communication with the Deputy Minister of Health in Egypt, and I do have access to a lot of the patients' records, whether inside Gaza and also in Egypt, which are not getting treatment because they don't have the facility for the treatments. So that's basically the question for yourself, sir. Okay, thank you very much.
It will be good to get that.
Thanks for your question. I think there's a couple of things to understand this. So there have been evacuations from other countries, such as Egypt. The cases are such that there isn't sufficient specialists available locally or in the region to other places. It hasn't happened in the numbers that are required. And there is a starting point for this, because if we remove, which is extremely difficult, but if we remove ourselves from the situation for a minute, just to assess what are the steps involve, to begin with, a clinical assessment. Because it may, in some cases, as difficult as it may feel to them and to think about it, may be less advantageous to move the injured individual, than it is to keep them stable in the place in which they are. And that can only be determined by specialists, clinical specialists, who will understand what is the impact or the suitability for fitness to fly, for example. When they get to the destination that is being proposed, are they going to receive adequate care? Is there capacity there? Do they have the specialists there? So there's a process that one has to go through first, and it includes that multidisciplinary team assessment. That's what we've done in the past with the children who went to Italy, and with the children who went to the UAE, and other organizations have done the same. There's also then multi-agency coordination that's required. So within, there's the World Health Organization, who is coordinating any such activity, because they have to be satisfied that from all the perspectives I've talked about, safety perspective of the individual as well, there's also safeguarding issues that we have to take into account, i.e. what's going to happen when the individual gets to the place. Do they have adequate guardianship and so on and so forth. So there's a whole number of things, but I would just suggest that at this time,